Hello and welcome to this week's webinar. To simplify proceedings, guests are muted. Please use the chat box to ask questions and questions will be answered at the end. Today is the second webinar of our summer series, and whilst there was a lot of excitement around the launch of our Crime-lite laser last time out, it's actually really great to be back doing a proper application-focused webinar again. This week we're going to be examining the topic of skin-deep forensics, taking a closer look at cuts, bruises, bite marks and all other aspects of forensic examination of suspects and complainants in sexual assault. Throughout the webinar we'll be using our range of crime-lites to explain the theory and techniques that enable forensic examiners to reveal vital traces of evidence in cases of sexual and physical assault. Not to mention the countless other crimes that may require the human body to be investigated as a crime scene in its own right. In the main, when we are examining the skin for evidence, our primary area of focus is the skin's outer surface, the epidermis, where we will be searching for cuts, scratches, puncture wounds and other marks. However, on occasion, we may also want to use light sources to examine below the skin surface to reveal areas of damage or trauma affecting the lower layers or dermis. Sexual assault, child sexual abuse and indecent assault has over recent years been on the increase here in the UK, although last year's lockdown did see a small reduction in cases. And while the number of reported cases is high, almost 163,000 last year in the UK, it is estimated that fewer than 1 in 6 cases are reported to the police. While there are many reasons that cases of sexual assault go unreported, some of the most commonly given include fear of retaliation, self-blame and shame, and a belief that the complainant's account will not be believed. The one area that we can directly influence the forensic examination is by improving the quality of evidence. Today we are going to look at the use of crime-lites in the search for evidence in cases of physical and sexual assault. It's long been recognised that high-intensity illumination has a key role to play in the examination of sexual assault victims. Outside of police forensic settings, clinical staff will often be equipped with a specialist light source for this type of examination. Unfortunately, the wide proliferation of light sources on the market has led to some confusion over the technology terminology, how it is best used, and for which applications. A quick look through past clinical papers and a scan through some forensic equipment manufacturers' websites will reveal that there are plenty of options available for anyone wanting to purchase a light source for the investigation of sexual crimes. Light sources known as woods lamps and UV torches are readily available, all offering to reveal semen, bruising and other traces of evidence. For today's examples, we're going to be searching for and examining evidence using the relatively new Crime-lite X. If you haven't seen the X5 before, then let me quickly explain that it's a multi-wavelength light source designed specifically for serology investigations to reveal semen, saliva, vaginal fluid and bruising. The name X5 comes from the fact that the light includes 5 different high-intensity LEDs providing UV, violet, blue, blue-green and white illumination. LEDs can be activated individually to produce a powerful narrow wavelength beam or combined to increase light output across a wider waveband. The X5 also has a bigger brother, the X10, that offers an additional 5 LED wavelengths to produce what is essentially a complete forensic light source kit within a single handheld device. So let's have a look at some examples. Bite marks and bruising are amongst the most common types of soft tissue injury incurred by victims of violence. In fact, it's been reported that bruising is present in 90% of physically abused children. Bruises can often appear as a bright blue-purple mark on the skin. However, the visibility of a bruise is linked to timing. Some bruises may take a little time to show themselves. By the next day, the victim has usually returned home and evidence is lost which may support their history of assault, if they do not choose to return for photographs. While in other cases, the colour of a bruise may fade over time. In cases of child abuse, it is all too common that delayed reporting of the crime gives bruising time to heal and disappear from sight. In both cases, this is where a crime light could be useful. Using our X5 to examine the site of a heel bruise under UV or violet illumination, we can reveal bruising that would otherwise be invisible to the naked eye. This is because a bruise is caused by blood being lost from the intravascular space into the skin and subcutaneous tissues. And while the healing process has removed all traces of this from the outer-facing epidermis, the low waveband illumination is allowing us to see through the top layers of skin to reveal the trauma below. It has even been demonstrated that in some cases, UV examination of bruising can enable the examiner to estimate the shape of the object that caused the bruise. This type of evidence can help us to build the case context when attempting to discern what may have happened to the victim. Further examination of the body using the Crime-lite X5 can, in addition to bruising, also allow us to better visualise scratches, cuts, bite marks and puncture wounds, and trace evidence such as fibres. Using the X5 in combination with a UV-sensitive camera, we can utilise the effects of reflected UV photography to visualise evidential marks on areas of the skin that might otherwise be difficult to see. For example, the bruising of a bite mark might be obscured by the presence of a tattoo. If we illuminate the surface of the skin using a UV light source and then observe via a UV-sensitive camera equipped with a lens filter that allows only the UV light to pass, blocking all other wavelengths, we can reveal only the bite mark. This is because the tattoo resides deeper in the skin than the UV light is able to penetrate. The same is also true of birthmarks. And that is a good example of why we use forensic light sources to examine the human body when searching for this type of evidence. Not only are we seeking to detect evidence in the first place, it is also vital to reveal the maximum amount of detail. In more than one recent high-profile criminal case, the detection of boot marks and even the indentation of boot laces on skin have proved vital evidence for examiners. The difference between a visual examination and an X5 examination could be the difference between a faint bruise and an identifiable mark. Of course, in cases of sexual assault, cuts and bruises are unlikely to be the only types of evidence present on the victim. Sexual Assault Referral Centres, or SARCs, are specialist medical and forensic services that exist for anyone who has been raped or sexually assaulted. Upon arrival at a SARC centre, a forensic medical examination is carried out by a qualified and experienced doctor known as a forensic medical examiner, FME, or a forensic nurse practitioner, FNP, with the intention of gathering any forensic evidence that may be available following a rape or sexual assault. This may include making an accurate record of any injuries that may have been sustained, as well as collecting any DNA evidence that may be present, and of course other trace evidence such as fibres. We now have a short clip of our application specialist Laura Dodd speaking to Sam Charles, a SARC examiner from the Glade at Worcester, who will explain more about her work and the type of forensic evidence routinely collected. Sexual assault investigations are often extensive and complex, involving a wide range of individuals and services working together. Sexual assault referral centres play a vital role within the UK in providing support to victims of this type of crime and recovering evidence from the victim which could be crucial to the investigation.
So thank you so much for joining us today, Sam. So we just want to ask you a couple of questions about kind of your work at Sexual Assault Referral Centre. So can you just talk us through the process of how you perform a forensic medical examination in your SARC centre?
Okay, so after the, at the moment we're doing a lot of telephone consultations prior to inviting them in because of COVID restrictions, but normally the client would come in. Obviously we would do the medical history, consent, establish the facts of the case, and that would help us to decide, help me to decide as an examiner what samples I think it would be appropriate to take, and that depends on how long it's been since the assault, so and just the circumstances really of the assault. So what happened, where, when, how, who. So once I've gathered all that information, then I can kind of make a judgment really on what samples I think I'd like to take. And so I would then prepare those samples before the client actually comes into the examination suite. I mean, things change when people come in to the examination suite. I might see an injury that the client didn't mention before or didn't have before that, you know, could have been, you know, a bite or skin to skin contact that I might then decide to add in swabs. But generally speaking, I prepared the samples in advance after a consultation with the client to find out what happened. So when they come into the examination suite, they would change in the bathroom into a gown so that I can examine them top to toe for any injuries, record those on a body map, and then usually at that point they will have given me a urine specimen as well when they're changing. So that would generally be my first sample, urine and toilet paper, the first wipe. If I need urine for toxicology or a pregnancy test, then that would generally be the first sample, because they tend to do that when they first go into the loo. So if the assault has happened in the last 24 hours, then we would try to get a second sample more than an hour later. But quite often the police have done an early evidence urine already, so my urine would in fact be the second one, usually. And then I would usually take swabs in the order that the FFLM guidelines for forensic examinations suggest. And there's every 6 months we have recommendations for forensic examinations in SARC, and they tend to suggest that we take swabs in the order on this these recommendations, which tends to be kind of top to toe, and the intimate samples tend to be last. So once we've completed all the samples and you know, finish that physical part of the examination, the client would then get dressed, go into another room, and we would I would seal and bag and seal the samples. So finish labelling, bagging and sealing the samples, double glove throughout with PPE on, so that I've completed that process before I leave the room, before I do anything else, because I need to, you know, finish that. And the crisis worker will look after the client while I'm doing that.
Okay, great, thanks. I'd like to go back to that aspect of the bite mark that you mentioned, because that's of interest to us. We're interested in marks and traces that are left on the body. And I wondered what specifics you do. I know that you use scales and you use cameras, as well as you talked about a body map, but I understand body maps and photographs are useful.
Yeah, so non-intimate injuries, I would measure and draw badly, probably, on a body map. Really just that they do, a copy does get submitted to the police, but and you know, that may be presented in court caught the body maps, but I'm very careful to write on there not to scale, obviously. So, I would measure the injury, I would record it on the relevant body diagram and describe it on the body diagram, but we don't actually take photographs of non-intimate injuries in the SARC generally. Certainly, there are some SARCs around the country that do that. And we have in the past had the facility for self-referral clients to take photographs for them as part of VEV, visual evidence. I can't remember what the second V stands for, and the crisis worker, but you have to be VEV trained to be able to do that. And I think that's through victim support. And they have got a camera with, it's like a Polaroid that prints out the picture straight away. But generally speaking, as an examiner, I'm not VEV trained to take photographs of non-intimate injuries. So we would ask the police SOCO to take those photos, and they quite often already have before the client has come to us. If it's something that's non-intimate and obvious and the client is aware of, they say, look, I've got this terrible mark on my neck, he bit me, that, they would hopefully have taken a photo. But if I find anything else, any bruises anywhere else, or abrasions or lacerations or anything that are non-intimate, that the police haven't photographed, as part of my handover back to the police, I would say, right, there are some injuries that need photographing, can you arrange that? And they contact SOCO, who've got cameras with filters that are really good at getting a good image of those injuries. Sometimes it might be appropriate to suggest do that tomorrow, because it will probably show up better tomorrow if it's quite soon. Things might show up that I see that weren't visible the day before when they first spoke to the police, for instance, so it's a changing situation. Intimate injuries, though, I would record on a colposcope, which is a camera and a light and a computer that burns those images or videos to disk. And those injuries, we keep those securely on disk in the SARC, and they are not submitted to anybody except on the order of a judge, because they're intimate injuries. A non-medical person would struggle to decipher what they're looking at. And actually, if the defence wanted to see those images, or the prosecution, but usually if the defence wanted those images, what they would have to do is employ an expert witness to review those images, a medically trained, usually a doctor, to review those images in a secure setting. Usually they would come to us, or a courier would go to them with them, and they would be brought straight back. They are not usually released in court. But sorry, I'm going off on a tangent. Going back to the bite mark on the neck. So I would measure that, record it on a body map, and I would want to do one wet, one dry skin swabs for saliva. Interestingly, on the body map and in my notes, I can't write bite mark, because I can't say how an injury has been caused. All I can say on my body map is there is a red or purple bruise, 2 arches measuring whatever that is. The client says the suspect bit her. So I can write on there what the client has said it was, but I can't say this is a bite mark, because then I'm acting as an expert witness. So, but certainly the swabs, so one wet, one dry, would hopefully collect saliva. So things that I might write, if I write on the bag, neck or breast or another part of the body, that it is likely that it will be because I suspect it was a bite, and you might well find saliva, on that.
Okay, so what other types of kind of common injuries do you actually encounter with your clients then, especially when they've been involved in a sexual assault?
It is very common to have bruises that the clients say are bite marks, especially to the neck and breasts on female victims. Other very common bruises are, if the assault has been violent in nature, there's quite often bruises over bony prominences, so knees, shins, hips, elbows. Quite often we might find fingerprint type bruising on upper arms and around wrists. If it's been an outdoor assault, quite often people have abrasions from falling on ground outside, or you know, hands, if they've had to put their hands out if they've been pushed or something like that. It is also, I mean, it's not common, you know, not every client that comes to us has injuries. You know, it really depends on the nature of the assault. But as I say, I would say that more victims have no injuries than have injuries.
So do you use forensic light sources to search for evidence on the client at all?
No, we don't do that. That's more the CSI, scene of crime, police officers that do that kind of thing. We you know, can only record what we see at that moment on that day in that room, you know, and we don't have light sources to look for evidence on people that we could then swab. And whether that will come in the future, I'm not sure. I know in America they stain injuries to get them to show up more, because I've seen quite a lot of American photos of intimate injuries, and they use stains on those injuries to make them show up more for photographing. But we don't use stains or lights, unusual lights. The colposcope does have a green or white filter on it that you can switch between if you're struggling to see. But actually we've just had a new colposcope in each of our 2 SOCs, and these brand new modern ones just do it all for you. So they auto focus, they auto select the right light and everything, and so there's a lot less fiddling around, you know, trying to see things. But I know SOCO, obviously, when they take photos of non-intimate injuries, they use different filters and different light sources to show up injuries, but I don't know if they use anything to show up any possible contamination. I'm not sure if they use that on people, or whether just they use it on scenes.
We'd also like to ask you about the mundane cleaning aspects, but very important anti-contamination before and after, and whether you're aware of the use of SARC LED light sources to aid in the cleaning process. I don't know if you come across that work.
Yeah, so the crisis worker, as well as being responsible for being the client's advocate, is responsible for the cleaning after every examination. So after the examination suite is sealed and locked, so nobody can go in and out of it until we actually have an examination. So we've got a pre-examination room, an examination suite with bathroom en suite, and then a post-examination room, which is a bit more kind of fabric sofas and things, which is just general cleaning. But the pre-examination room has got plastic furniture that can be properly, you know, forensically cleaned, and then the examination suite that can be forensically cleaned. So after each examination, once the client has left, the crisis work, I will then disappear into the office to finish my paperwork, the endless paperwork and everything. And the crisis worker has got a protocol to go through for cleaning. And so at the moment with COVID, that's even more than ever before. So it was always forensically clean before, but now they've added in time delays for COVID to allow anything in the air to drop. So after the examination, we leave the examination room, the client's left, 20 minutes to allow any sort of anything in the air that might be hanging about to drop. And then the crisis worker will go in and do the first spray with Distal. So they spray absolutely everything with Distal, and then come back out and wait another 20 minutes. And then they go in, they change their scrubs after that, then they go back in and they clean the examination suite and any rooms that we've used with Distal. So either the spray bottle or it's in a solution in a bucket. So obviously clear out all the bins first, clear everything out first, and then clean literally top to bottom with distal, either spray, double gloves and spray and disposable cloths, or a disposable mop. And so they clean their way out, the bathroom, the examination suite and the pre-examination room, they clean their way out, and put clean bin bags in, and that's it. Then that room is sealed again. Once a quarter, scene of crime cleaners come. So an external provider come, and they use various techniques. Obviously, I'm not sure exactly what, but I know they take swabs. I know they use light sources and things, and they do a deep clean every quarter. So before they do the deep clean, they test to see if we're cleaning properly, and if anything can be recovered using various techniques, which they're the experts in. And then they do the deep clean. And then I know that the SARC manager gets a report back to say what the level of cleaning was found to be. Was it good or not, and any areas that had not been cleaned properly, any common areas. But I think, as far as I know, we've always had a really, really good feedback from the quarterly deep clean, so that's good to know.
Excellent. Yeah, brilliant.
So just really, is there any advice you can provide to any of the kind of forensic scientists, police, law enforcement agencies that are watching? Is there any advice that perhaps you can give for the current processes that they do, maybe to maximise the amount of evidence which can be recovered from kind of the victims, the complainants, the clients that you might deal with?
I think it's kind of making sure that you really know what the story of what happened is, and that really helps the police and the scientists that are examining the samples to focus on those swabs that are most likely to give, some evidence. As I say, we could just swab people from head to foot and submit hundreds of samples, but that's not cost effective, and it's also, it doesn't help you to focus in on the most likely samples to test. So I'm sure it's very helpful for you if we actually write on the MEDEX form in the free section at the back what the allegation is, because otherwise you're fumbling around in the dark, aren't you? You don't know what. And I think it's really, really important that as examiners, we give you the information so that you and the police know the reason that we've taken those samples, and because we think they're the ones that are most likely to give a positive result for DNA or semen or saliva or whatever it is. And so I guess it's just that, read the story, the history of if it's been written, if we've done our job properly, look at the back and see what we've said happened and where the injuries were and what we think, that we've body mapped. I will always write that an allegation was made of the following by what type of person, while under the influence of alcohol, but feels was spiked, or injuries found to here and here, and then I'll also write down if there's something I haven't taken that I would have wanted to take because the client's declined. So client declined speculum examination, so blind high vaginal swabs taken, or client declined proctoscope examination, so unable to do more than an anal canal swab, that kind of thing. So I'll hope, hopefully we've told you why we haven't done something that actually would have been appropriate, because at the end of the day the client can consent or decline any part of the examination. But I think it's more that you can only test what we give you, so I can't really give you advice about what you could do to get more evidence, because it's kind of down to us, isn't it, to get the right samples, I think. And And the police, you know, we do a consultation with the client before we do the examination. So we're not just basing what we do on what the police handover has been, because that's just a first account. It's often, you know, quite brief. So again, it's up to us to get the proper story from the client, if they can remember. And unfortunately, sometimes the client cannot remember anything other than just a tiny flashback if they've been given a substance.
Thank you very much for that interesting interview, Laura and Sam, which also demonstrated how anti-contamination in SARCs is paramount. In order to ensure cleanliness, contaminants need to be visualised, and this is possible using Crime-lites. In our mock medical examination suite, we can show you what Laura discovered with the Crime-lite X5.
So what we're going to show you here is actually in areas where anti-contamination is vital. We're going to show you how you can use something like our Crime-lite X5 light source to search areas around rooms, and here we can already see areas of contact marks across the walls in our medical suite, which indicates that these areas still require cleaning before we can move on to our next examination. Moving on to the medical examination bed, first we view it in white light and all appears clean. But as we move into our blue light source again, we can actually see areas across the top of the bed which are beginning to fluoresce, which indicates there are areas of debris, contact marks, simply areas which will require cleaning before we can have another examination take place in this area. So we move down the bed, we see further areas which might require cleaning, but all very simply illuminated using our Crime-lite X5 light source. Around the sink, we can now see marks all across the wall. Perhaps here these could be areas which might need further cleaning or anti-contamination procedures taking place. As we move further across the room, areas which might be touched by the examiners more frequently, like the cupboards or the bin, we can start to see evidence of contact marks, areas of staining, which might require further cleaning. And then finally on the wall, we actually see a handprint, a further indication that this medical suite definitely does need a further clean before we can have an examination take place.
So this is the medical examination kit that I was involved in several years ago now, but we improved the kit by creating a simple elasticated couch cover that the complainant was concerned about. As soon as they got onto the bench, it would move, a single sheet of paper that was usually rolled out. So this was a big improvement. Lots of swabs, because a lot of swabs are always taken. Within the kit we have the mouth collection module for allegations of oral intercourse. We have alcohol, drug, urine module, which is important to collect the urine to demonstrate alcohol or drugs in the system. And of course the disposable speculums that are used in conjunction with the swabs. There's a lot of literature about what happens now and the forensic medical examination forms that have to be completed by the forensic medical examiner or the nurse practitioner. And that's really it, but I wanted to show you some of the kit. As a serology light source, the X5 can reveal minute traces of body fluids, including semen, saliva, urine and vaginal fluids. This is achieved by performing a fluorescence examination, exposing the evidence to intense narrowband illumination at one wavelength and causing it to emit fluorescence at a higher wavelength. By wearing viewing goggles that filter out the illumination wavelength, we can view only the fluorescence to reveal evidence as a bright, high contrast stain. When illuminated with the correct wavelength of light, body fluids will continue to emit visible fluorescence, possibly after the perpetrator attempts to destroy evidence. In recent years, crime-lights have been used to great effect to reopen cold cases through the detection of body fluids on evidence held in storage for many years. An example of this is the World's End murder case, a criminal investigation into the murder of 2 teenage girls that took place almost 40 years ago, was finally closed following the re-examination of evidence using Crime-lite forensic light sources. Known as the World's End murders, the horrific murders of Helen Scott and Christine Eady in Edinburgh in October 1977 remained unsolved for decades, despite thousands of interviews and many hours of police detective work. Despite the passing of years, the case remained in the public consciousness, and investigators never gave up hope of unravelling the brutal crimes. During a cold case review conducted between 2011 and 2012, the vital breakthrough was made when evidence from the case that had been kept in storage was re-examined using Foster and Freeman crime lights. Under the intense narrowband illumination of a crime light, forensic examiners were able to locate previously undetectable traces of semen and saliva. The new evidence provided a direct DNA link between the prime suspect, Angus Sinclair, and the murdered girls. Using evidence uncovered using the crime light, prosecutors were able to take the case back to court, where it was successfully argued that the case be reheard. It was Scotland's first ever double jeopardy case. And in November 2014, Angus Sinclair was jailed for life, with a minimum of 37 years behind bars. Lord Advocate Frank Mulholland, the most senior law officer in Scotland, later said of the crime light, "Without crime lights, there would have been no trial." So impressed was he with the technology that he recommended the light sources be introduced to all Scottish forensic laboratories. Most of you will be aware that here at Foster and Freeman we manufacture a wide range of light sources suitable for this application. In this instance, I'm going to use the Crime-lite Auto to demonstrate fluorescence examinations. I'm using the Auto because not only does it provide really intense illumination, but it also includes the camera and specialist filters required for viewing the resulting fluorescence. It is in effect a complete forensic science search kit, resembling the size and shape of a DSLR camera. Using the Crime-lite source or the Crime-lite Auto fully integrated solution is not only a powerful method of revealing evidence, it also has the added benefit of being quick and easy, and perhaps more importantly, non-invasive. In crimes of such high sensitivity, it is vital that we as examiners do our utmost to avoid prolonging the length of examination and perform the examination as quickly and efficiently as possible. Forensic light source examination can help examiners to achieve this. Beyond cases of physical and sexual assault, the same principles of light source examination can be applied in the field of a victim identification. At the scene, an examiner might use a light source kit or a device such as the Crime-lite Auto. In a laboratory, it may be possible to use a larger piece of equipment such as the Crime-lite ML Pro, a fully integrated forensic triage system for the rapid location and markup of evidence. The ML Pro takes all of the key elements of forensic light source examination and combines this with the additional functionality of semi-automated examinations, high magnification imaging, evidence markup, UV visible infrared photography, and casework management. So in addition to the examinations that we might carry out on a victim of sexual assault, what we might hope to find when conducting a forensic light source examination in a bid to identify a victim, well, one good example of an identifying feature could be a tattoo. In normal circumstances, a tattoo should be clearly visible to the naked eye. However, with almost never-ending variables of forensic casework, there is every chance that the examiner could be asked to identify a faded or obscured tattoo, or even a tattoo that has been purposefully removed. In these circumstances, an examiner could turn to an infrared imaging as a means of revealing the identifying mark. As we mentioned earlier, a tattoo exists deep within the dermis layer of skin. Unlike UV and visible light, infrared illumination is able to penetrate through the layers of skin to reveal latent traces of tattoo ink below the skin's surface. We can use this technique to reveal tattoos that have been surgically removed or covered up. We've seen today that in cases of physical and sexual assault, the human body is treated as a crime scene in its own right. Using a forensic light source or laboratory imaging system, we can better visualise hard-to-see evidence such as bruises, marks and tattoos, but also traces of body fluids that may otherwise have remained all but invisible to the naked eye. While a single wavelength of light may assist in the detection of some evidence types, the examiner must search across the forensic spectrum if they are to reveal the full range of potential evidence. Obviously, in today's short webinar, we've only had time to scratch the surface of this topic, but hopefully we'll have made you aware of how Crime-lite technology can be of benefit in your forensic examinations. Now we're going to switch to our live Q&A. So if you have any questions, please type them into the chat box in the bottom right-hand corner of your screen, and we'll do our best to answer them in as much detail as possible. Thank you.